Hello, hello. We are live on RootMD, and we are going to be talking about hair loss, hair transplants. Very, very excited. Um, we are going to be talking a lot about hair loss on this channel. And so I'm very excited for everyone who's joining. My name is Dr. Ross Kopelman. I'm a hair transplant surgeon based out of New York City and Palm Beach, Florida. And we're going to spend a tremendous amount of time educating you as it pertains to hair loss, hair transplants. So do not hesitate to ask me any questions that you want. I am going to be answering a lot of your questions as it pertains to hair loss. And let's get going. We are building the largest and biggest and fastest growing hair growth community in the world. And we want to educate you as much as we can about hair loss and hair transplants. So if you're joining for the first time, welcome. Do not hesitate to ask questions. We're getting questions from all over the place. So let's jump right in. The number one cause for hair loss is a hormone known as DHT, dihydrotestosterone. This is going to miniaturize hair follicles. What's critical for you to understand is that there are only really two pharmaceutical medications at our disposal that help us to combat hair loss: finasteride and dutasteride. And believe it or not, these drugs were approved back in 1997 for hair loss. Can you imagine? It's been almost 30 years and we haven't had a new medication yet approved for hair loss. So this has been a long time coming. But those are the best medications when it comes to addressing hair loss. So if you're joining for the first time, do not hesitate to ask me as many questions as you want. I'm more than happy to answer your questions as it pertains to hair loss, hair transplants. I love answering questions because it helps to educate you so that you make informed decisions about how to navigate your hair loss routine and your hair care. So please ask me questions, keep them coming. I want to know exactly what bothers you so that I can do a good job answering your questions. Let's get going. Um, is too much dandruff a sign of hair loss? Okay, so dandruff is seborrheic dermatitis. This is a buildup of Malassezia yeast. It's indirectly associated with hair loss. What do I mean by that? If you're going to itch your scalp on a consistent basis, guess what you're going to do? You're going to cause some scarring alopecia to the back of your scalp. And yes, then in that case, there can be some hair grafts that can fall out. But if you're having dandruff and it's really irritating you, of course, you can try a prescription shampoo, 2% ketoconazole. You do need a prescription from a doctor for that. But I also like clobetasol foam. I find clobetasol foam to be very effective at addressing hair loss, and so that would be my recommendation there. Okay, so what other great questions can I answer for all of you? You love my lives the most. Well, thank you. Well, I guess I'm the OG, but you know what? Some of our other live creators are really learning and becoming really great at what they're doing. And our goal is really to educate as much as we can. And we want to be on here as many hours as we can. If we can do 200 hours a month, great. Okay, are you on finasteride? So I do take a DHT blocker. I use a dutasteride, and dutasteride, I microdose the drug. That means I don't take it every single day of the week. And with finasteride, you can do the same. I also like oral minoxidil because what oral minoxidil does is it actually thickens the hair follicle. So critically important for you to basically be using these two medications in conjunction. Does oral minoxidil create dread shed anytime? Okay, so Joe, what you're concerned about is a temporary shedding that can happen. And this can happen for 2 to 6 weeks after starting hair loss medications, but it doesn't always happen. Okay, that's the critical thing for you to understand. It does not always happen. It typically appears when someone has telogen effluvium. Telogen effluvium is a temporary hair shedding condition. And so I see sometimes an acceleration of hair shedding from patients who are on these medications, and they're, they can get an acceleration of that shedding. All right. What if you're training? Okay. I went to medical school. I did fellowships in hair transplants. I traveled around the world. I've been to many conferences. I've been doing hair transplants for quite a few years. I'm 17. How do I regrow my hair without finasteride? If you don't want to use finasteride, you can use natural things. So there's saw palmetto, rosemary oil, pumpkin seed oil. These act as natural DHT blockers. I also like oral minoxidil because oral minoxidil, again, will help thicken the hair follicle. Can oral finasteride or minoxidil be life-threatening for health? Well, these are very safe medications. They've been taken for many many years. There are millions of patients that are on these medications. So I'm not really that concerned about patients being on these medications long term. In fact, you have to really think about being on these hair loss medications long term, because it's fertilizer for the hair. So Rogaine is minoxidil, okay? And that's going to improve blood circulation to the scalp. What it's not going to do is it's not going to act as a DHT blocker. And DHT is a major contributor to hair loss. So don't forget that. If you're joining for the first time, welcome. My name is Dr. Ross Kopelman. I'm a hair transplant surgeon based out of New York City and Palm Beach, Florida. I also do virtual consultations with patients across the country. If you do need a consultation, you can book above. But yes, let's keep those questions coming. Is post-finasteride syndrome real? There's a tremendous amount of fear-mongering. Fear-mongering is patients telling terrible stories about what has happened to them. None of my colleagues have ever seen post-finasteride syndrome. Now, what is possible is that there are millions of people now taking these drugs, and there is always a possibility that someone's going to develop some rare side effect. And the reality is that if you have post-finasteride syndrome, it's most likely you either stop the medications abruptly, maybe you were taking them for years, or you have an underlying erectile dysfunction that then gets it appears, okay? My other theory is that if you're getting post-finasteride syndrome and you didn't have any issues sexually before, well, guess what? What's interesting is that 1 out of 10 men have increase in sex drive. Why does that happen? Because testosterone converts to DHT, okay? And when you're blocking that, testosterone levels go up. And so it's possible your sex drive is higher actually taking finasteride or dutasteride. And then you stop it abruptly or you stop it. Well, guess what? You don't get as much buildup of testosterone. So we don't have anything in the research that verifies post-finasteride syndrome is a real thing. But yeah, if you want to stop these medications, it's incremental stopping. Now, let's talk about the most common reasons for hair loss. The number one reason for hair loss is genetic hair loss. And with genetic hair loss is polygenetic. Your mother's side, your father's side, either side of the family tree. So both sides of the family tree are impacting your hair. We can't just blame mom. We can't just blame dad. It can be either side. So what are you supposed to do about it? Well, you could do nothing. You can have progressive hair loss. We all have progressive hair loss. Even I have some progressive hair loss. If I knew what I knew today, guess what? I would have been more proactive using hair loss medications or natural things, but I didn't know, and now I do. That's why I spend a lot of time educating you about what I do know. So androgenetic alopecia happens because you are very sensitive to a hormone known as DHT, dihydrotestosterone. And dihydrotestosterone miniaturizes hair follicles. Yes, taking finasteride 3 times a week actually really does work. And on top of you using oral medications, I like using topical. I like specifically dutasteride from a company known as Zion, XYON. And they have a great topical dutasteride that I like to use on my scalp. And I like to use it in conjunction with oral. I've been taking finasteride for 15 months, but I want to jump on dutasteride. Is it smart? Well, Kevin, I've had patients on finasteride for 30 years. You don't have to run to dutasteride. You can continue to stay on finasteride, but sometimes it's okay to switch. Again, I don't know unless I see you as a patient. If you did need to see me in a consultation, you could always book a virtual consultation if you're not located in New York City or Palm Beach, and I'm more than happy to help you. So what other medications are important? Well, is there a blood test that can help diagnose the cause of hair loss? No, there really isn't. It's diagnostic. It's trichoscopy, looking underneath the microscope, and that's what I do at my office. And then I also sometimes have to biopsy, but biopsying is not always critically important. Okay, what other great questions can I answer for all of you as it pertains to hair loss and hair transplants? Keep those questions coming. Side effects on minoxidil oral. Great question. So women are worried about unwanted hair growth in places that they don't want it, but I have never seen any female grow a beard. Headaches and migraines are more common. Weight gain I've seen in 1 or 2 patients, very rare. But again, these side effects are not that common. Women can start on 1.25 milligrams, men 2.5 milligrams. Would you recommend someone going to Turkey? What are the pros and cons? Okay, first and foremost, let me explain something to you. Complications arise. If you go all the way to Turkey, who is going to manage your complications if you have issues when you come back? I don't know. Actually, interesting enough, I just had a patient who did a consultation with me yesterday, went to Turkey for a hair transplant, and then decided to consult with me because he had no one to manage his medicine. So who's going to manage your medicine when you go abroad? Okay, you should be working with someone who's a hair loss expert, a hair transplant surgeon, someone who really understands medical management well. And so, he was very, very thankful. He actually found me on TikTok, and he was very thankful that he found me because I really put him on the correct regimen. They're not incentivized to put you on the right regimen. Also, a lot of patients of mine develop folliculitis. I mean, it's very common. 50% of patients develop folliculitis after a hair transplant. And so that needs to be managed. And so who's going to do that? The other problem is that these Turkey clinics, they have like 10 or 20 surgeries going on in a single day. And what I essentially could promise you is that what the doctor is doing is they're greeting you at the front door. They might be drawing the hairline, but once surgery starts, they're not doing the surgery. So I think there's a lot of deceptive things that go on in Turkey, unfortunately. What do you think about PP405? When will it be on the market? I think we have a while until we see PP405 appear. PP405 is a drug being developed by Pelage Pharmaceutical out in California. And what's exciting is a lot of patients don't want to do they don't want to use hormonal medication. So this is a way to stimulate stem cell activity. How much is a consultation with you? An average cost of a hair transplant, Karen? Our consultations are $350. They cover you for an entire year of care. My philosophy is this is comprehensive. So my goal is not to just see you once. I want to see you for a long time, okay? Because hair loss is ongoing. So yeah, if you needed a consultation with me, Karen, please feel free to book on our bio above. What is your hair loss stack right now? Jack. Okay, so at the top of my list is going to be oral dutasteride. I like oral dutasteride because it happens to be the most effective DHT blocker that we have at our disposal. It decreases DHT by about 90%. Finasteride does it by about 60%. I used to take minoxidil, and I wish I could, but I get headaches, and so I can't take minoxidil. And then I use topical dutasteride. I use it from a company known as Zion XYO, and it's the best in my opinion. And then, of course, I use the RootMD shampoo that has DHT blockers in it. It has saw palmetto, pumpkin seed, and rosemary oil. And then I have our hair serum that I use 2 or 3 times a week, and I apply this to my scalp. I'll use a couple of drops, and I apply this before the shower. So that is my routine in terms of how I address my hair loss. When do you see results after using minoxidil? Well, you have to be patient. That's a critical thing. Okay, everyone wants like yalla, 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 let's go. But the reality is that it takes, 3 to 4 months to start to see an improvement. So you really have to be patient in terms of when you're going to be able to see results. And that's essentially what the story is. So what other great questions can I answer for all of you as it pertains to hair loss, hair transplants? Do not hesitate to ask me any questions that you want. Did you get headaches from oral? I got headaches from oral minoxidil, so I can't take it. So that's why I can't take it. But topical, no issues. Do you think you'll ever try minoxidil again? I have tried it. I will probably try it again. But I'm actually happy with my routine. As long as I'm using a DHT blocker, that's really the top of the pyramid, honestly. Where can I get the topical DHT? I can no longer take oral medications. Okay, so I would book a consultation with me and I can get you started. More than happy to help you as it pertains to hair loss and hair transplants. Keep your questions coming. More than happy to answer your questions as it pertains to hair loss and hair transplants. Oh, thank you so much. And Al, guess what? We do have a conditioner that's coming out. I think it's going to be out in 2 weeks. So we're going to have our DHT shampoo and DHT conditioner here on TikTok. Really exciting. Took us many, many months to develop. So that combo is going to be beautiful. So I'm really excited for that. Thank you, Al, for being part of our community. By the way, RootMD is the fastest and largest hair growth community in the world. So I'm very happy that you're all part of it. Why can't we tests be done which DHT meds work best? Okay, so you can actually. There's a genetic test. It's a swab of the mouth. It's called a tricho test. And you can get a readout in terms of whether you're a good responder to spironolactone, to minoxidil, to dutasteride. It's about $500, but sometimes it's worth it for patients. But most patients are good responders, so I don't run to do a genetic test unless patients are having issues and they're not getting good responses to these meds. Side effects of oral finasteride and dutasteride. Okay, let's go through it. So at the top of the list, you can get inner groin pain or testicular pain if you're a man. Decrease in sex drive. 1 out of 100 men, but 1 out of 10 men have increase in sex drive. So there's more benefits than not. Gynecomastia, which is enlargement of male breast tissue, very rare. And for women and men, increase in anxiety and depression, only if you have a history. Um, um, yeah, so what other great questions can I answer for all of you as it pertains to hair loss and hair transplants? Do not hesitate to ask. So happy to have all of you here on the live. It's been good to have you back. But yes, um, yeah. What other great questions? How long does it take for you to apply your topicals, and do you ever get annoyed having to apply it? I use my topical at nighttime, and it takes me 10 seconds. So, I mean, I don't spend all day. I'm all about simplifying routines, Jack. Uh, yeah, those were side effects for finasteride and dutasteride, but they're not common because when I microdose the drug, I don't see the issues happening with patients. I don't get phone calls, patients complaining that they're having issues. So, yeah, really good questions. Thank you so much, everyone who's joined. Yeah, really, really good questions. Okay, so androgenetic alopecia is the most common form of hair loss. We treat that again with dutasteride and minoxidil. And then, of course, we have to talk about telogen effluvium. Telogen effluvium is a temporary hair shedding condition that can last 6 to 9 months. And the reality is that if you don't do anything, it will resolve on its own. But if you want to be proactive, yeah, I do put patients on hair loss medications. Now, why does telogen effluvium happen? It happens for a lot of reasons. Usually stress from 3 months before, and it could be from breaking up with a girlfriend, a boyfriend, losing a job. Maybe you got sick. Maybe you lost a significant amount of weight. You're taking Ozempic and Wegovy and Mounjaro or any of these medications. Anything that causes stress to the body can cause you to have temporary hair shedding. And so, what's critically important for you to understand is that you have to you can go on medications, um, but you don't have to. And if you want to, you can also use natural things. So you can use saw palmetto, rosemary oil, pumpkin seed oil. There's a lot of different things that can help and be effective in terms of addressing hair loss, especially with the hair shedding, because it could be very distressing to both women and men who are experiencing this type of shedding. Okay, what are the great questions? Is it good to use castor oil 4 hours after applying topical? I don't like castor oil. I think castor oil has no impact whatsoever in terms of addressing hair loss. It might help with the scalp environment. It is a very viscous oil, so what it does is it creates an illusion that the follicle is actually thicker than it actually is, but it's a waste. It's not. It's not at the top of my pyramid in terms of hair loss, medications or anything to do with yeah. How do I find you to make an appointment? Well, here's my name, Dr. Kopelman, and you can go above to our bio, and there's a way to book a consultation with me. I'm using a topical of minoxidil and finasteride as propylene glycol. I'm not a big fan of using topicals that have propylene glycol because it can cause irritation to the scalp. Jack, if you want, I'd book a consultation with me, and I'm happy to help you, guide you, and I need to see you as a patient to give you the proper medical guidance. Yeah. So androgenetic alopecia, telogen effluvium. Now we have alopecia areata. This is where you get circular patches on your scalp. This is an autoimmune hair loss condition where your own body attacks your hair follicles. For this condition, I like to use steroid injections on top of the hair loss medications. And of course, there's many other types of hair loss conditions I say. Now, when I'm not treating hair loss, I'm treating patients surgically, and I perform hair transplants. So I perform two different approaches to hair transplants. There's the FUT approach, where we take a strip from the back of the scalp, and there's FUE, where we take individual follicles one at a time from the back of the scalp. The question is, which one is better? Okay. 80 to 85% of hair transplants now around the world are performed by FUE, follicular unit extraction, where individual follicles are removed from the back of the scalp. Now, what is the benefit of doing an FUE? Well, you get a wider area to take hair from. And there's two approaches when we do FUE. We can shave everything, or we can do what's called the unshaven hair transplant. The unshaven hair transplant is where we don't shave your hair at all. And the benefit of that is your ability to bounce back is much faster. We're talking about a 2-week downtime versus a 3-month downtime in terms of your hair regrowing. So there's a lot of benefits from a social standpoint, and also from a surgical standpoint to do an unshaven hair transplant. But FUT also has its benefits because sometimes the grafts are more beautiful, more luscious, and less transections. So the ability to be able to do both, the versatility to be able to do both is critically important. My office, Birdie, is located in New York City and Palm Beach, Florida, but I also do virtual consultations with patients across the country. So average cost of our hair transplants, our hair transplants start at 25,000 and they go all the way up. I'm switching to 2.5 milligrams of oral minoxidil and discontinuing topical and tretinoin. Do I need to taper off minoxidil? Everything that you do, you need to taper. You need to go slowly. Okay, nothing should be gradual in terms of addressing, in terms of stopping your medications, because if you abruptly stop medications, sometimes you can stimulate some shedding. Can temples at Norwood 2 grow back with finasteride or minoxidil? Yeah, sometimes, but it depends if you have these little baby vellus hairs on your scalp, and that's a critical thing for you to understand. Okay, what are the great questions can I answer for all of you as it pertains to hair loss, hair transplants? Do not hesitate to ask me anything that you want. I'll tell you a little bit about RootMD. RootMD was started by myself, my sister, and a patient of mine, and our goal was to really grow a community. Yeah, it could be 500. Yes, I am a doctor. I'm a hair transplant surgeon. So our goal was to grow the largest community in the world focused on hair loss and hair growth. And we really have done that. We have close to 20,000 members in our community now. And we're spending a tremendous amount of time educating patients about hair loss and hair transplants. And so we started this back in July, and now it's April, and this community has grown. It's very supportive. I've answered thousands of questions as it pertains to hair loss. I've guided thousands of patients, even patients who did not come to me as actual real patients, but who asked me questions on the lives about hair loss. And our community is continuing to grow. The other beautiful thing, yes, I do eyebrow hair transplants. It's one of our specialties. I love eyebrow hair transplants because patients love the fact that they don't have to do microblading to their eyebrows, which can look very unnatural. Chronic shedding for almost 7 years with, I am doing lives. Do you like me on, Jack? Am I doing a good job? Let me know. If you think I could do a better job, I'm always here for guidance. I do try to come on here once a day and go live, educating patients about hair loss and hair transplants. So yeah, chronic shedding for almost 7 years with sensitive, tender scalp. A tender scalp makes me think of something called LPP, like implanopilaris. And in chronic shedding, we also have to rule out, do you have a vitamin D deficiency, folate, ferritin, iron storage in the body? There's a lot of things we have to look at. If you did want to set up a consultation, Linyata, more than happy to help you. Okay, what other questions can I answer for you as it pertains to hair loss and hair transplants? This is a very supportive community, so we're very appreciative of everyone who's joining, who's asking questions, who's engaging. Oh, that's so nice, Jack. Where's everyone from, by the way? Our hair oils are good. So actually, the hair oil that we have below, and do I have the hair oil here? Can you pass me the hair oil? So the hair oil that we have, this is the RootMD hair serum. And this has saw palmetto in it, rosemary oil, and pumpkin seed. And what I'm going to tell you is that you can use this 3 to 4 times a week before the shower, about 30 to 60 minutes before. You put about 3 to 5 drops on your scalp. And this has natural DHT blockers in it, okay? So this is a natural way to help prevent further miniaturization of hair follicles. So you can definitely check this out. We sell this on TikTok. And it's part of my routine as well. Now, of course, I also use hair loss medications. You apply it to a dry scalp, and you leave it on before you shower. So 30 to 60 minutes before a shower, dry scalp, rub it into your scalp. This is not for the hair. It's really for the scalp. You want it to really get into the scalp environment. And then you wash it off because it takes time to build up a tolerance to using hair serums. And this can be very helpful in terms of addressing your hair loss. All right, what other questions can I answer for all of you as it pertains to hair loss and hair transplants? I'm more than happy to answer those questions. Thank you for joining. We do ship around the globe. So yes, we've actually shipped this to Australia, the Middle East, Canada. This has gone everywhere, which is quite amazing. And our shampoo, of course, and we have a conditioner that's coming out soon. So I'm really excited for that. What other questions can I answer for all of you? Should you microneedle before using the serum? Not necessarily. I'm actually not a huge fan of microneedling because I'm worried that patients are going to cause some irritation to the scalp and some scarring from over microneedling. So just be very, very careful if you do that. King is from the USA. Amazing. Where's everyone else from? Anyone from New York? Anyone from Florida? Anyone from the Middle East? New York, Upper Manhattan. You got to come to my office. I have an office on 90th and Park. No, well, I don't like to do hair transplants on anyone under the age of 25 because we have a finite amount of hair in the back of our scalp, so we have to be very careful in terms of how much hair we take. What are the great questions? Can I use finasteride along with the oil? Yes, you can. Absolutely, and I do that already. You have a pilot on oral minoxidil and dutasteride. Yes, I do. I think you asked me that yesterday. Morocco, amazing. We have a person from Morocco, amazing. We have someone from Orlando. So it's nice. We got a nice crowd from all over the place. Okay, what other questions can I answer for all of you as it pertains to hair loss, hair transplants? I'm very excited to see people from all over the place. Okay, I'll be coming soon. My PCP is on 95th and 3rd. Okay, I'm 90th and Park, so right around the block. Really need the moisture to come out, doc. Don't really trust other hair companies' products. Patriot, absolutely, I understand. And by the way, the best way to start is you do a consultation with a doctor. Whether you come to me or you go to someone who's a hair loss expert, that is critically important. That's very helpful. Okay, so if you're having crown and temple thinning, you should be on hair loss meds. The DHT blockers actually work the best on the crown, believe it or not, so they're very effective there. Yeah, well, there's a lot of reasons to stay local. There are some amazing hair surgeons in the United States. I practice in New York City and Palm Beach, so I practice in these two different areas, and so I spend a tremendous amount of time educating patients here around the globe. And I have patients who come to me from all over the place for hair transplants. You use topical finasteride along with the hair oil? Yes, you can, just different times. So the topical finasteride you apply like in the morning time or in the evening time. The topical oil or hair serum, you're going to want to apply. You're going to want to apply this before the shower. Washington, amazing. If you need a recommendation for San Diego, just message me in the chat, not in the chat, in the DMs on TikTok, and I will absolutely get back to you. Okay, what other great questions can I answer for you as it pertains to hair loss, hair transplants? I'm really appreciative for everyone who's been asking me questions. More than happy to keep asking any questions that you have. Can tight hairstyles for years cause permanent hair loss? Absolutely. Are you kidding me? This is called traction alopecia. I just saw a black patient actually yesterday who wears very tight braids, and she's experiencing hair loss. It's hard to not wear the braids because guess what? Those braids are there's a cultural reason why you want to wear braids, but it's causing irreversible hair loss. So if you do have braids, the goal is to loosen up your hairstyles. Once there's recession, can that be helped with meds? It can help a bit, but sometimes, Karen, you need a hair transplant. But medications are important to prevent further recession as well. Can a white man wear braids? Yeah, why not? Why not? I don't see any issues with that. Okay, what are the great questions? Thank you, everyone who's joined. My name is Dr. Ross Kopelman. I'm a hair transplant surgeon based out of New York City and Palm Beach, Florida. Spent a tremendous amount of time educating patients about hair loss, hair transplants. So yeah, can PRP help with recession? PRP has a tremendous amount of variability. If you take blood on a Monday versus Friday, different levels of growth factors. If I take your blood versus my blood, different levels of growth factors. So I like mesotherapy better. I think it's more effective. Does diet affect hair health at all? Of course, if you're going to eat sugary candy all day or really bad food, this is not going to be good for your hair. So yeah, eating a balanced diet, high protein is critically important. He was just on meds, Jack. and he gets mesotherapy of his scalp, no hair transplant for him. Um, and I also see his wife. It's so interesting. They fly in to see me. It's amazing, from California. So unbelievable. What are the great questions can I answer for all of you as it pertains to hair loss, hair transplants? Do not hesitate. Next live creator is going to be Amanda. She's amazing. So yeah, I do a lot of Afro hair transplants. So you can always come to me if you want a hair transplant or consultation. If you're wearing a really tight hair baseball cap every day, yeah, of course. But most people don't wear really tight hair caps. The hair serum made me lose hair. Well, you might have initial shedding, and that's good actually. When you have initial shedding, that means it's actually working. And you have to be patient. It takes 3 to 4 months to really see a significant improvement. What other great questions can I answer for all of you? Thank you for joining. I love this community. The RootMD community is growing. We have amazing live creators. What are something you would never do or put into your hair as a doctor? Gum. You don't want to put gum in your hair because once you put gum in your hair, you can't get it out. You got to cut it out. No, I don't like castor oil. I'm not a huge fan of it. It doesn't really help with hair loss. There's certain things that you just want to be careful with. Anything that's going to dry out your scalp. Washing your hair actually is pretty damn important. Washing your hair every single day or once every 3 days is critically important because you get a buildup of sebum around the hair follicles, and this can cause some hair loss because sebum has DHT in it that can miniaturize follicles. What are your thoughts on long-term bleaching? So if you bleach all the time, it's not going to be good for your hair strands. It's not going to cause hair loss, but it's not good for the follicles. It's like the whole hair strand. So I would be careful. Yeah, we are available. We're actually sold out at the moment with our shampoo, but we're going to be back very soon. We had a very high demand for our RootMD shampoo, and we're excited. We have a conditioner coming out and DHT organic pills that have saw palmetto and pumpkin seed that I think you're going to like as well. What are the great questions can I answer for all of you as it pertains to hair loss and hair transplants? Really excited because next live creator is Amanda. She's one of our hair technicians at Kopelman Hair Restoration, and she is a really good moderator. She's going to spend a lot of time with you for the next hour educating you about hair loss, hair transplants. So I'm excited for her to come on, but I hope I did a good job. No, they're not going to go back a different color. I wouldn't be too worried about that. If you haven't already, please make sure to follow and connect with us. I do hope that you get to see me live again. I do try to come on here at least anywhere from 30 minutes to an hour every single day to educate you as it pertains to hair loss and hair transplants. Why would you recommend, please, for sensitive scalp, slightly painful scalp? I have oily scalp. If you have a slightly painful scalp, look up LPP. This might be causing some of the issues for why you have pain in your scalp. Yeah, Dr. Kopelman is the GOAT. You're so kind. But I can't be on here 24/7. So that's why we have to grow with other amazing educators on the RootMD community. So that's why, one day at a time, as they say. But I will try to be on here more frequently so that I can answer your questions as it pertains to hair loss and hair transplants. But keep your questions coming. Yeah, Lauren's great too. Julian's great. Mahaz is great. Christine is great. We have some amazing live creators, and we have a new person coming live. She's a future dermatologist. Therese she's going to be great too. So yeah. Yes. Okay. What other great questions? Okay, I'm going to log off. Amanda's going to be on. She's going to do amazing. So stay on here with her, and she's gonna spend a lot of time educating you next about hair loss and hair transplants. She's coming on literally this second. So I hope that this was educational. You learned a lot, and I hope that you come back to see me